Okay, my name is Kwan Jacob. I am the pioneer infection prevention nurse for Banso Baptist Hospital and the infection prevention nurse for the Cameroon Baptist Convention Health Services. When we started infection prevention in Banso Baptist Hospital in 2002, it was quite challenging. First because the concept was new to everyone, even including me, who was called upon to supervise infection prevention. And therefore, we took a lot of time trying to sensitize people to be able to understand what infection prevention is all about. And in the course of that, we learned along the way, and they were able to introduce some very important innovations. Example being the alcohol hand rub, which we introduced in Banso Baptist Hospital in response to outbreak of neonatal sepsis, which was a very serious problem at that time. And it is very interesting to note that after we introduced a number of measures, including alcohol hand rub, we were able to eliminate the outbreaks, and presently our babies get well and go home with no problem. Some of the challenges we have faced, and especially at initiation, was behavioral change. Behavioral change means that people have the ideas in their minds, but sometimes to implement is completely another thing. And we had a lot of difficulties trying to convince people to understand that infection prevention was important. But today I'm very glad to say that at least the organization has adopted infection prevention as the best strategy to improve quality of care. And the staff now are aware, and the hand rub is available in all the facilities at the point of care, even including workstations and staff pockets and in offices. Then the second challenge that we faced was the lack of resources. You know, in developing countries, resources are very limited, and especially financial resources. And therefore, it limits us to what kind of strategies we can implement. And therefore, most of the things that you will conceive, if you do not have money to implement, they will just remain there at the level of conception. And so, this has really been a very major setback on the implementation of infection prevention in the Cameroon Baptist Convention health services. The third challenge is leadership. You know, generally speaking, in most of the facilities where the leaders buy into the concept, you will see a significant improvement. But in some isolated cases, you will have a facility where the leader does not even mind. And therefore, in such facilities, infection prevention practices are a little bit poor. We had this experience in 2017 when we implemented the WHO framework for hand hygiene in all the facilities of the CBC health services. And then we noticed that in facilities where the leadership was strong, then there was a remarkable improvement. And in facilities where leadership was weak, there was very, very insignificant improvement. And then the third challenge, and the most important one, is lack of opportunities for networking as well as for training. You know, in Cameroon, we do not have infection prevention organizations, and so sometimes you don't even have people that you can be able to share ideas with them as well as learn from them. And this has really been a very major setback to us because even the ideas that we have that we could have even implemented nationwide is very difficult because we don't have people who have the same ideas and who at least buy into the fact that infection prevention needs to be implemented across the country. And then concerning training opportunities, in Cameroon we don't have any facility or any school that offer training in infection prevention. And because of that, we just have to learn by doing. Even though over time we have organized so many seminars, we've also attended so many seminars both in the country and out of the country, and we have been able to learn. But then, I mean, to be able to significantly change infection prevention, you will really need formal training from the diploma up to the degree master and PhD level. We don't have such opportunities in Cameroon. And therefore, if the academia is not really involved in promoting infection prevention, then it becomes very, very challenging. So we believe that in the couple of years to come, we should be able to create opportunities so that we can be able, somebody who actually interested in specializing in infection prevention can be able to have training right up to the PhD level. Now, I'm going to also talk about our relationship with Infection Control African Network, ICAN. I joined membership of ICAN in 2015. Before then, I had actually known Professor Shaheen, who was the chair of ICAN at that time. I knew her in 2006 when we met in Cape Town during the International Federation of Infection Control Conference. And when they created ICAN, I was not aware, so I came to join ICAN in 2015. And from that time, ICAN has opened my eyes to a new horizon where I am able to network with so many organizations and so many professionals across Africa as well as the rest of the country. And so we are now working together with infection prevention professionals from many African countries, including Malawi, including Tanzania, South Africa, Egypt, Uganda, and so on and so forth. And because of this networking, we have been able to share ideas and learn from other people and what is happening in other places. And therefore, concerning ICAN also offers a lot of trainings. We have attended infection prevention, water hygiene and sanitation trainings organized by ICAN in Cape Town. We've attended one in Malawi, and then we also organized one that was hosted right in Cameroon that was sponsored by ICAN, and in that one we had 12 different countries represented, and we believe that this is a very, very important opportunity that ICAN has opened our eyes to it, and through those trainings we have been able to develop significantly. ICAN is also involved in research, and I believe that in the next couple of years ICAN is going to be organizing research writing seminars, which we are going to learn in order to know how to at least to develop research projects, implement, and then even publish research articles in infection prevention. The next opportunity is that ICAN is also offering training at the diploma level, degree level, postgraduate, and sometimes even up masters and up to PhD levels. And therefore, we believe that through these opportunities, at least infection prevention is going to significantly improve in Africa, as well as Cameroon in particular. So I want to believe that ICAN is very, very strategic organization, and we believe that anybody who wants to improve infection prevention in Africa should be able to walk through ICAN. And I pray that ICAN should be able to have support, especially funding from organizations, so that they can be able to realize the dreams that they have for Africa. And ICAN has also implemented a lot of projects. We have the 10 African Orange Project, which is an initiative to promote hand hygiene in Africa. And Professor Sain has been strategically responsible for this. And in fact, we are organizing seminars and so on and so forth. And as a board member of ICAN, I've also learned how to manage organization as such. And I believe that in Cameroon, at least when we eventually have infection prevention organization, at least through the initiative experience that I've had from ICAN, I believe that we will have a very strong leadership. Thank you. I'm sure this one will be shorter.